So basically consider your skeleton as a bank, as a bone bank. So what happens in osteoporosis is that the rate of deposit is less than the rate of withdrawal. So you're withdrawing more money out of the bank and putting less in. Similarly, you're withdrawing more calcium out of the bones and putting less. By mid-20s to early, late 20s, that's your peak of your building of bone mass. दिन भर बैठे रहते AC room में, रात भर काम करते, दिन भर सोते, sunlight कब मिलेगा उनको? जी रहे हैं, बिता रहे हैं जिंदगी, नहीं जी रहे हैं. That is the difference between those two. जितना भी धूप में बैठने से हड्डी मजबूत नहीं होती. एक्सरसाइज, बोन्स हैव टू बी लोडेड, यानी आपको चलना पड़ेगा, आपको एक्सरसाइज करना पड़ेगा. अगर हड्डी खाली सिर्फ कैल्शियम ले रहे, विटामिन डी ले रहे, बैठ के सन में बैठे हुए, कुछ नहीं होने वाला है आपको. वंस और ट्वाइस अ वीक यू शुड डू एन एक्सरसाइज that makes you go out of breath. People are too proud not to take a stick. I don't know why. Use a stick, it offloads the joint. And when you have pain here, you take a stick on your right hand, not the left hand. But this is the most important question people ask me. Kya karna, kab karana surgery? So knee replacement is not like heart surgery. It's not life-saving surgery. But it is lifestyle surgery. You feel that your life, it is affecting everything that you do in life. Yani chair se uthna, subah uthna, हर चीज़ के लिए टाइम लग रहा है. यू आर थिंकिंग, अरे वहाँ नहीं जाऊँगा मैं क्योंकि वहाँ पर सीढ़ी चढ़ना पड़ेगा, नहीं मैं ट्रैवल नहीं कर सकता हूँ क्योंकि मुझे एयरपोर्ट्स में चलना पड़ेगा. सो ऑल व्हेन इट्स अफेक्टिंग योर लाइफ, यू आर स्लोइंग डाउन, यू आर नॉट एंजॉइंग लाइफ, and you have X-ray changes of grade 4 osteoarthritis. Get it done for God's sake.
Om Shanti. A very good evening and a warm welcome to Shanti Sarovar. So today's session is very special and indeed a need of the time, I would say. Yes. So how many of you are here for the first time? How many of you are here every Sunday? So you will know, my next would be introducing the organization. So for those who are here for the first time, Brahma Kumaris is an international socio-spiritual organization spread across 110 countries with one vision and one aim of spiritually uplifting individuals for world renewal. So they have been servicing the society since over 85 years, and currently the headquarters, international headquarters, are in Mount Abu, Rajasthan. And the campus you are sitting in, it is the largest retreat center of Brahma Kumaris in southern India. And we have more than 8,000 branches across the globe. And within India, I'm sure within a radius of 5 to 10 kilometers, you'll find a branch of Brahma Kumaris. The meditation we practice and learn here is called Raj Yoga meditation. That is to connect with the self, connect with the Supreme, and become a master of our own thoughts. So Sunday evening talk is a very unique concept that we have at Shanti Sarovar. It is a weekly refreshing dose for you to, get that booster for your next week and also get it head start on a positive note. And Shanti Sarovar, of course, most of our sessions inspire peace in life, give you that inspiration to inculcate habits of positivity, spirituality, and meditation. But today's session, like many other sessions in this series, focuses on health, which is equally important for peace of mind. Yes, because a healthy body is required to have that sense of stability in life, sense of peace. So I don't think so I need to emphasize on the topic, because knees is something we know are very important. We must crawl in our foundation years, then only we can walk. Crawling on our knees, then we can walk. And when things are not going right, we feel weak in our knees. So I can go on about the idioms on knees, but that's not what we are here for. We are here for the technical and the specialist guidance on how to prevent and how to treat osteoarthritis. And for this, we have a very esteemed expert with us. Let us give a very warm and loud round of applause for Dr. Udai Prakash, who is here. Let us welcome him on stage. Dr. Udai Prakash is the director and chief of joint replacement surgery and sports injuries And brother, you can take a seat. I'll take 2 minutes to highlight your distinguished profile to all the audience. So he has over 25 years of experience globally. He has trained in UK as well as Australia and is an esteemed and a very keen researcher with very high impact journal publications in peer review journals. And he is a very expert in a very specific technique that is called as Oxford partial knee replacements. With over 100 surgeries he does every month. And he has done multiple ACL and PCL reconstructions, which he will of course elaborate. Please pardon my runny nose. So brother is a very expert that is here to guide us on how to prevent knee injuries and how to treat. He will give his guidance to us. So over to you, brother, as we look for more strong and long-lasting knees. Thank you.
Thank you. Thank you for the introduction, Om Shanti. Vasanta ji was in the clinic the other day, and out of the blue, she just asked me, how about giving a talk to us on Sunday? And this was like just a few days ago. So I thought, Arey, ye to bahut jaldi hai. So I didn't know what the plans were on Sunday. So I said, I'll get back. And I forgot that there's a dinner tonight at my sister's. So I said, I cannot go back on my commitment. So here I am. And so the topic I said we'll discuss is knee osteoarthritis, because that's what I see. Most of my patients are suffering from knee osteoarthritis, but also a lot of other complaints in the body. And mostly they need reassurance, 90% of them. Unfortunately, Google and Grok and AI is causing a lot of problems to me, because patients are coming with a lot of misunderstanding about a lot of their conditions. And they become instant doctors and tend to advise me as well as to what I should be doing for them. I thought I'll speak a little bit about osteoporosis, because I think it's a topic that most people don't know much about, but are silently suffering. And I see a lot of youngsters here as well, so I think, going forward, perhaps they could keep that in mind. So let's move on. So what is osteoporosis? So you must have heard of a term called brittle bones. Basically, these are weak bones, and often called silent disease, because many of us are suffering with osteoporosis, not knowing that we are suffering from osteoporosis, and just a minor tumble or a little fall can cause a fracture. And that's how it comes to light the first time for many patients. So basically, consider your skeleton as a bank, as a bone bank. So what happens in osteoporosis is that the rate of deposit is less than the rate of withdrawal. So you're withdrawing more money out of the bank and putting less in. Similarly, you're withdrawing more calcium out of the bones and putting less back into the bones. So that's what happens, and we'll discuss why it happens. You can see this. I'm sure some of us can sort of understand, or we have seen our parents or grandparents, lose their height. And they become, smaller and start to bend over, and that is osteoporosis. So that's when you're in your youth, in your 60s, and this is maybe in your 80s. Okay, so this is because of osteoporosis. Now, you can prevent that happening to a certain degree, but it is inevitable in all of us. So look at this side of the picture. You have a dense bone and a porotic bone. So lots of air cells, lots of empty space within the bone. So the calcium and phosphate levels are much less in these bones. तो हिंदी में भी मैं कोशिश करूँगा बीच-बीच में बोलने की. तो ये बेसिकली ये हड्डी में आपका डेंसिटी कम हो गई है. तो ये हड्डी थोड़े से भी छोटे से फॉल से भी टूट सकती. तो वी हैव सर्टन बोन्स, यानी थोड़ी हड्डी है बॉडी में जो इजीली टूट सकते हैं. तो आप सुना होगा ना, हिप फ्रैक्चर है या रिस्ट फ्रैक्चर है या शोल्डर फ्रैक्चर्स है. सो दीज आर जनरली सीन इन older people, यानी 60-70 के बाद ये जो दिखते हैं, so these are osteoporotic fractures generally or insufficiency fractures. Now, unfortunately, it is around the globe. 1 in 3 women will suffer from this, and 33%. In fact, the percentage is a lot higher. India में ज़्यादा है ये. मैं बताऊंगा क्यों. Men में कम है ये problem. This is very important. Yeah, fractures due to osteoporosis happen 10 to 20 years earlier in India. We'll go into that. And these figures, I think, are conservative figures. 2.5 lakh hip fractures in India per year, probably 5 times that amount, I would say. And these are from literature, but I think from what I see in India, it's far more. Vertebral, yani backbone fractures, these are also very common. So basically, you have to go back to your childhood. Now, if you're an old person, it's too late. If you're a middle-aged person, it's too late, right? Because your bones will build up to what we call a peak bone mass. By mid-20s to late 20s, that's your peak of your building of bone mass. उसके बाद से हड्डी आप जमा नहीं सकते. मतलब you can maintain it, and slowly it will start to come down after that. So if you miss the boat in childhood, you will never be able to reach that peak bone mass. ठीक है? तो our children are starved of the basics, rich and poor. Now, when I say rich, you'll say, why? They get everything. But not. They are malnourished because they eat the wrong kind of food. And that is also malnourishment. Okay? And these children, you can see these inner city schools or even in rural areas, they don't have playgrounds. Problem is both the parents and teachers. I blame both of them. And I blame them because they are emphasizing too much on studies. बच्चा थोड़ा ही पढ़ सकता, पूरा दिन नहीं पढ़ सकते. स्कूल से आकर दूध भी नहीं देते होगे. ट्यूशन आ गया, ट्यूशन मास्टर आ गया, या ट्यूशन चलो. खेलना, ये लोग सिर्फ फोन्स पर खेलते हैं, ग्राउंड्स में नहीं, प्लेग्राउंड्स में नहीं. So that is a problem. So we are seeing, I see a lot of children with problems with bones by the age of 10 to 12 years. This is missing by and large. इनको टाइम ही नहीं है आजकल खेलने के लिए, बेसिकली. और कहाँ खेलोगे? कई जगह है हैदराबाद में खेलने के लिए. हम लोग जब बड़े हो रहे थे, एबिट्स में भी खुली जगह थी, हर जगह. It was an open space. When Nizam had this concept of Jannat on earth, he had that concept and he was sticking with it until things changed after 1948. That's when we got democracy, or basically anarchy. Jo karna hai karo. So now we are seeing Gachibowli was open. Now look at it. There's not even a footpath that is worth giving a name to. So we are suffering because children are not getting exposed to the sunlight, to the playgrounds, to hours of play. And that is why they're suffering. And by the time they're in their 30s, they're getting into the wrong jobs. इनके जॉब भी गलत है. दिन भर बैठे रहते एसी रूम में, रात भर काम करते, दिन भर सोते. सनलाइट कब मिलेगा उनको? Terrible situation. We are living longer though. जी रहे हैं, बिता रहे हैं जिंदगी, नहीं जी रहे हैं. That is the difference between those two. So मैं आप लोग को peak bone mass के बारे में बोला. This is critical. So we have to build our bones. We have to play. We have to jump. We have to run. We are not seeing the child in our children. We have to have a child in us till we die. That is so important. So this is what we see very common now in a country full of sunshine. Vitamin D is only available in sunlight. Right? In certain types of fish, perhaps, but not in big amounts. Now, abroad, they fortify the milk with vitamin D because वहाँ पर sun उतना नहीं होता है. लेकिन इंडिया में क्या excuse है? There is no excuse. So this is normal alignment. If you drop a line from the center of the hip to the center of the ankle, it should go through the center of the knee. Okay? So that's a plumb line. If you drop that here, this is what we call a varus knee, and a bow legs. This is what we see very commonly in India, in older people. In young girls, we see this, knock knees. They come to me like this. And they are pale. They look sick. They have not seen sunlight for ages. And I'm talking about certain communities that, unfortunately, they get covered after they reach puberty. And उनका मकसद ये है कि इनको कैसा भी 18 years तक यहाँ पर रखना, उसके बाद शादी कर देना. So they're not exposed to sunlight, they're prevented from playing outside. And we see this very, very commonly. If you catch them early, you can educate the parents and the child, and you can do something about it by giving braces. But if they come late, 13, by the time they're 13, most girls have grown to their height, right? So they don't have much growth after that. So then you have to surgically fix this. So this is an example of a patient we had. So you can see this girl has knock knees, and this plumb line is going from the outside of the knee joint. Okay? So then we have to do this nasty procedure. It's called distal femoral osteotomy. So you correct the femur, and then the plumb line will go through the center of the knee. And this is how we correct them. But then by then they're educated, so they know about the importance of sunlight and vitamin D. Because vitamin D is very important to take the calcium from your gut to the bone. It's a conduit. Right? It takes from the gut, so you're from ये अपने पेट से लेके हड्डी तक ले जाता है. ठीक है, तो विटामिन डी उसी में सनलाइट में ही होता है. तो दैट इज वाई हम लोग विटामिन डी कितने हर जो कोई भी ऑर्थोपेडिक सर्जन के पास गया उसको विटामिन डी देते हैं हम लोग. तो इट्स लाइक सो कॉमन. ठीक है. So this girl is now, walking, running around and all that. She has built up her bones, and she has another 10 years to build up her bone mass to the maximum level. So ultimately your health, whether it is bone health or not, really any health, depends upon how you look after your body. And we got introduced earlier, your mind. If your mind is happy, your body is happy. And the people around you are happy. You're spreading happiness around. Always laugh, always laugh. Laughter is the best medicine, is the oldest statement, right? So if your mind is happy, you're physically much better. Even if you're not the perfect body weight, you are still able to carry on a good life if your mind is happy. So a good healthy childhood should continue into adulthood and old age to keep your bones strong. So outdoor activities should be as important as your studies, in my opinion. If you don't play, if you're not happy, then you can't read. How much will you take in? You can't concentrate for more than an hour. बच्चों को दिन भर पढ़ाते हैं. And for what? I'm sure if they study less than 50% of what they are actually studying, but they're also playing, they'll actually soak in a lot more from their books than forcing them to study. So osteoporosis, so इतना मैं बात करा अभी, क्या होता क्या है? वीक बोन्स रहे तो थोड़े से भी टंबल ऐसे यहाँ से गिर गया तो हड्डी टूट जाती. और ये this is happening in 50-year-olds, 45-year-olds. इंग्लैंड में, यूएस में, you see them in 80-year-olds. It's very, very late because they are independent. वहाँ पर क्या है, बच्चे लोग साथ में नहीं रहते हैं, so they have to look after themselves. तो उनको बाहर निकलना ही पड़ता हर चीज़ करने के लिए. और वो they are very concerned about their physical health. बाहर निकलते हैं, 60-70 years में भी टेनिस खेलते हैं, ट्रैकिंग करते हैं, बट वहाँ पर चलने के लिए जगह भी है ना. गवर्नमेंट सोचती है अपने हेल्थ के बारे में. यहाँ पर कहाँ सोचते हैं आपके हेल्थ के बारे में? सिर्फ बात करते हैं, योगा करो, ये करो, वो करो. योगा से, स्ट्रेचिंग करने से थोड़ी फिट हो गए आप. हाँ, जरूरी है नहीं, लेकिन उसे people think that yoga is a stretching of the body. It's not. There's a lot to yoga than what you think. What we see on the TV is ये स्ट्रेचेस कर रहे, ये कर रहे, वो कर रहे, लेकिन देयर इज पावर योगा, देयर इज yin yoga, there is vinyasa, all these things are so important that, I mean, and not just physical fitness but mental fitness as well. So what we know about yoga in general, by and large, general public, is very very little, right? So इसमें ये प्रॉब्लम्स होते हैं, रिस्ट फ्रैक्चर्स होते हैं, वर्टिब्रल फ्रैक्चर्स होते हैं, ठीक है, इसको फिक्स कर सकते हैं. देन आफ्टर दैट यू नीड अ लॉट ऑफ थेरेपी to get your bone health back. So the treatment starts by preventing falls, right? So when I was in England, we used to talk to the general practitioners, in fact, spend a lot of time talking to patients. They send teams of people to go to people's houses, especially elderly people's houses, to look at how easy it is for them to move around. यानी अगर कोई लाइटिंग कम है तो लाइटिंग इम्प्रूव करो. तो रात में कई elderly people have to get up at night to go to the bathroom. So make sure that the lighting is good, that the switches are easy to get to, and remove loose rugs. ये अब जो डालते हैं ना डोर्स के सामने, people tumble on that, wires, loose wires, all these things. You should be very very careful in your home. Just make sure that any loose bits are but अगर grandchildren रहे, उनके toys रहे, उस पर गिर जाते हैं लोग, because they don't see little dogs running around in the house, suddenly they'll come in between your legs. So all these things you have to think about. Grab rails, especially in bathrooms, you need to have something to hold on to. And most of my patients who fall and come with fractures fall in bathrooms, because अपने पास पानी फेंकने की तो बहुत आदत है. So and they use marble, right? You can't see. So and you have to use stone that is non-slip, and keep cleaning the tiles regularly so that it doesn't form a layer of moss or something like that, slippery layer. And for elderly people, they need to sit on high chairs or dining chairs so that they can get off easily with arm rests, right? Otherwise they have difficulty getting out of a chair also. A good diet, a lot of sun and exercise, we keep talking about it, we know about it, ये लेकिन हम लोग करते नहीं, आलसीपन. Go out and enjoy your life. तो ऑस्टियोपोरोसिस अगर आपको है, यानी आपकी बोन्स कमजोर है, तो क्या कर सकते? अब चल तो नहीं सकते ज़्यादा क्योंकि कमजोर है. जितना भी धूप में बैठने से हड्डी मजबूत नहीं होती. एक्सरसाइज, बोन्स हैव टू बी लोडेड, यानी आपको चलना पड़ेगा, आपको एक्सरसाइज करना पड़ेगा. अगर हड्डी खाली सिर्फ कैल्शियम ले रहे, विटामिन डी ले रहे, बैठ के सन में बैठे हुए, कुछ नहीं होने वाला है. आपको कुछ नहीं होने वाला है, कितना भी कैल्शियम खाओ, कितना भी विटामिन डी दो. Bones have to be loaded. It's called the Wolff's Law. The more you load the bone, the stronger it gets. It doesn't matter how old you are. You can build. अपन bones के बारे में बात कर रहे हैं. I didn't even talk about muscle. अगर हड्डी मजबूत है तो आपका मसल भी मजबूत होना चाहिए. तो you can build muscle even into your 70s. ठीक है? तो along with exercise, I mean, when I talk about stretches in yoga, you have to use weights also. Your body weight is enough. You can use your body weight to build up your muscle and your bone. Any age, doesn't matter. ठीक है? तो कई ये DEXA स्कैन से आपको पता चलता है, एक स्पेशल टाइप का एक्सरे होता है, ये पता चलता है कि कितनी हड्डी आपकी स्ट्रांग है. So they compare, say, a 50-year-old's bone strength to a 25-year-old's. That's the standard. It's called the T2 score. तो ये DEXA स्कैन से पता चलता है कि अपनी हड्डी कितनी स्ट्रांग है. मेडिकेशन तो है ही, लेकिन सिर्फ जैसा मैं कह रहा था, मेडिकेशन खाने से आपकी हड्डी उतनी स्ट्रांग नहीं होती जितनी आप मेडिकेशन विद एक्सरसाइज. ठीक है? और कई मॉडर्न मेडिसिन आ गए, मैं इसके बारे में बात नहीं करूँगा क्योंकि आई एम टॉकिंग टू अ जनरल ऑडियंस, आई एम नॉट टॉकिंग टू डॉक्टर्स. मोस्ट ऑफ दीज फ्रैक्चर्स, ये हिप फ्रैक्चर है, दिख रहा है आपको बॉल सॉकेट, यहाँ पर फ्रैक्चर है, तो उसको ऐसा फिक्स, यू कांट लीव अ हिप फ्रैक्चर. हिप फ्रैक्चर अगर आपको हुआ तो फिक्सेशन जरूरी है. अगर उसकी सर्जरी नहीं किए तो आप नहीं चल पाओगे जिंदगी भर, ऑलमोस्ट सर्टन. So most hip fractures will require surgery, unfortunately. तो दो टाइप के सर्जरीज है. ये फिक्स, खुद का हिप फिक्स कर सकते हैं, या कोई खुद का बॉल रहेगा यहाँ पे, या तो बॉल बदल सकते हैं इसका. It depends upon what kind of fracture it is. ये ऑस्टियोआर्थराइटिस है। ऑस्टियोआर्थराइटिस यानी आपके हड्डी घिसने लगती है ओवर टाइम। सो अगर आप ये 4 स्टेजेस देख रहे हैं, ये तो माइनर आर्थराइटिस है, यानी लोग जब शुरुआत में थोड़ी अगर आधा 1 घंटा बैठ के उठने लगे तो थोड़ा सा स्टिफनेस लगता है, सो दे हैव टू जस्ट स्टैंड फॉर अ कपल ऑफ सेकंड्स देन दे कैन वॉक, तो दैट इज अर्ली आर्थराइटिस। ये स्टेज 2 में आपको ये देख रहे हैं ना, ये नी का जो जॉइंट है यहाँ पर क्रैक्स आने लगे आपके कार्टिलेज में, यानी जो लाइनिंग होता है जोड़ का, दैट इज कार्टिलेज, तो उसमें थोड़े से क्रैक्स आने लगते हैं। तो इसमें भी थोड़ा सा दर्द कभी बढ़ता है कभी कम रहता है, ठंड काल में बढ़ जाता है, इन वार्म वेदर में अच्छा लगता है। तो धीरे धीरे ये 2 से 3 पहुंचता है, तो 3 में क्या है, एक्सटेंसिव चेंजेस आने लगते हैं और एक्सरे में भी चेंजेस दिखने लगते हैं। और 4th में एक्सटेंसिव, यानी ये जैसा कारपेट घस गया आपका और फ्लोर एक्सपोज होने लगी। So imagine like that analogy I'm giving you. So basically the floor is getting exposed and now you have to change the carpet. तो वो स्टेज पर आ गया है ये, ठीक है। So this is what it looks like on X-ray. This is normal knee joint. ऊपर की फीमर बोन है, टिबिया बोन है और ये जोड़ है। ये जो गैप है, ये गैप आया नहीं। यहाँ पे हैदराबाद में गैप आया बहुत कहते हैं, यहाँ पे गैप चला गया तो प्रॉब्लम हो गया गैप रहा तो अच्छी चीज़ है ये, ठीक है। सो यहाँ पर देख रहे हैं कि हड्डी और हड्डी रगड़ रही है एक दूसरे। दिस इज लेट स्टेज, दिस इज स्टेज 4। दिस इज व्हाट दिस इज व्हेन यू स्टार्ट थिंकिंग अबाउट सर्जिकल ऑप्शंस। उससे पहले यू कैन ट्रीट विद other options. So osteoarthritis occurs when protective cartilage on the ends of your bones wears down over time, and it has a high prevalence, especially in elderly patients, making it a leading cause of disability. And this is one of the most commonly seen problems in this country. In Europe, they also suffer from hip osteoarthritis. Is almost equally as common as knee. यहाँ पर दिखते नहीं हिप का प्रॉब्लम्स, यहाँ पर हिप के प्रॉब्लम्स यंग लोगों में दिखते हैं। आप सुने होंगे ना एवीएन के बारे में, एवास्कुलर नेक्रोसिस, जब खून का दौरान रुक जाता है हिप के बॉल में। कोविड के बाद बहुत हुआ ये, क्योंकि कोविड में इंडियन डॉक्टर्स ने स्टेरॉइड्स का ओवर यूज़ किया। स्टेरॉइड्स देने से कई यंग लोगों के हिप्स खराब हो गए और हम लोग इतने 100 में बदले। वी हैड टू डू लॉट ऑफ हिप रिप्लेसमेंट्स। So, if your doctors out there, always practice evidence-based medicine. Don't do what your lecturers have told you in medical school. They are often wrong. ठीक है? So this is traditional medicine that has gone on from generation to generation. जैसे जर्रे लोग हैं, वैसे कई doctors भी वैसी practice करते हैं. You have to make sure that you practice evidence-based. So they gave grams and grams of steroids in people who didn't need it. So ये बहुत common है। और खैर और भी कई वजह है, अल्कोहल है and certain medicines है, उसके वजह से भी होता है। So ये तो बता चुका मैं। So this is what you see generally. Bow legs ऐसे टेढ़े होने लगते हैं, and this is a problem because people then become slow, they slow down, they can't keep pace with their colleagues or with their family who's walking in a park or something like that. They start to sway, ऐसा चलने लगते हैं और बैठकर उठने से 4-5 सेकंड उनको रुकना पड़ता है। they can't walk because ऑयल ख़त्म हो गया है। so startup pain है, यानी इंजन का ऑयल कम हो गया तो स्टार्ट नहीं होती गाड़ी। एक बार चली तो ठीक है, थोड़ी दूर चलती, उसके बाद गर्म हो जाती, फिर रुकना पड़ता है। ऐसे ही इसमें भी थोड़ी दूर चले फिर बैठना पड़ता, फिर उसके बाद थोड़ी देर के बाद फिर उठ के चल सकते, ऐसे ही। सो बेसिकली ऑयल खत्म हो गया है इसमें। तो पेन, स्टिफनेस, स्वेलिंग, ग्राइंडिंग साउंड भी आता है उसमें, एंड रेंज ऑफ मूवमेंट, यानी आपका मूवमेंट भी कम हो जाता है, एंड डिफॉर्मिटी। ये सब सिम्टम्स और साइंस है ऑस्टियोआर्थराइटिस। ऑस्टियोआर्थराइटिस कई डिफरेंट टाइप्स ऑफ आर्थराइटिस होते हैं, लेकिन आई एम ओनली स्टिकिंग टू ऑस्टियोआर्थराइटिस बिकॉज दैट इज द मोस्ट कॉमन। ठीक है, सो दिस इज जनरल वेयर एंड टेयर, एवरीबडी गेट्स इट, लेकिन कुछ लोगों को मतलब टेंडेंसी ज़्यादा होती है। तो इट कुड बी फेमिलियल ऑल्सो। कई लोगों के ग्रैंडफादर्स अगर उनको थे severe arthritis, तो आपको भी हो सकती. My granddad had very, very severe osteoarthritis. But luckily I'm okay so far. तो X-ray में grade, so we saw the pictorial. So this is grade 1, grade 2 यहाँ पर gap कम होने लगा, यहाँ पर और भी कम हो गया, almost 80% is gone, यहाँ पर हड्डी और हड्डी रगड़ रही है. So this is what we see when we take X-rays, ठीक है? And that's why we take standing X-ray. यानी आपको full weight bearing X-ray लेना चाहिए. अगर लिटा के लिए तो you don't see the real arthritis. Of course, you can see very, very severe arthritis. You can see on lying down X-ray. But by and large, we call this standing X-rays. तो prevalence यानी अगर आप एक 100 लोगों को लिए रोड पर से और उनके X-rays करें, 10% above 55 have severe disabling OA. यानी एक randomly एक 100 patients 100 लोगों का X-ray किया तो उसमें से 10% have severe OA, यानी हड्डी और हड्डी रगड़ रही है उनकी. रेडियोग्राफी यानी एक्सरे पे अगर देखें आप तो 100 लोगों में से over 65, 70% will have osteoarthritis. So that's very common. I mean, imagine 65-year-olds कोई मतलब from anywhere, any congregation like this, or I mean, you pick 65, you take their X-rays, they'll have osteoarthritis, most of them. They may not have many symptoms. यानी उतना सतारा शायद नहीं होगा, लेकिन रहते हैं इनको. Again, like osteoporosis, 3 times more common in females. The reason why it's common in females is because, by and large, as a culture, women are not sports oriented. Their role is different in society. And this is what I think everybody should understand, including women, that their role is not just cooking or looking after the family. It's much more than that. That role is extremely important. I'm not saying it's not important. If you want to do that, it's fantastic. Men will continue to enjoy. But it is very important that you also look after yourself. अगर खुद अच्छे हैं तो दूसरे भी अच्छे रहते हैं घर में. So I give the analogy of the flight, right? When the air pressure goes down, what do the flight attendants say? अपना mask पहले डालो. Because if you are breathing oxygen, if you are healthy, then you can help others. Similarly, look after yourself. If you are healthy, then you are able to look after others in a much better way. So that is very important. So, in fact, even abroad, it's not 3 times as common, but it is more common in women. Maybe 45-55. यहाँ पर 70-30. So most 70 to 80% of my knee replacements are done in women. And very early. They start coming to me from the age of 35 onwards. It's absolutely so surprising to see them in 35, 40. They're all obese. They've not seen the sun for years. Their diet is wrong. They hardly walk. Once the daughters mature, they stop working because the daughters will start working at home. Then the daughter-in-laws come. खत्म 45 के बाद बैठो, हर चीज़ सर्व होती है कि ऑर्डर करो, बस बैठे रहते हैं ये लोग. In addition to that, what happens if they go to a doctor? The doctor will say, don't walk, don't sit on the floor, don't take the stairs. ये कहाँ सीखे ये लोग? Where is the evidence of that? नीचे नहीं बैठना मतलब you have been designed to sit on the floor. If you don't use the back cartilage of the knee, then it will disappear. तो बैठे रहो, लेटे रहो, पैसे दो, नौकर है, चाकर है और बहुएं हैं, करेंगे आपके लिए जिंदगी भर. 45 से, right? So it is so important that you realize the importance of an outdoor life. And in a city, यानी 1 मंजिल से 5 मंजिल हो गई वो बिल्डिंग बिना परमिशन के, कोई कब पूछेगा नहीं आपको, बस पीछे नीचे से चलेगा, मतलब GHMC को खामोश रहोगे। तो हर जो हमारे बचपन में 1 मंजिल का जो घर था अब 5 मंजिल हो गया, रोड वैसी ही है, right? So people are not walking on the streets because it is a threat to their life. They can't walk. Where can you walk in Hyderabad? Tell me. KBR Park, Botanical Gardens. बस और कहाँ चलोगे आप safely? You can't walk, right? So can't blame them, can you? Who will you blame? I think you have to blame ourselves as society because politicians are coming from us, right? We are at fault. But if you and I want to get into politics, you can't because that is their domain. Impossible. So you can't improve Hyderabad. Raho aisi. Keep traveling abroad and getting your exercise. यहाँ पर तो नहीं मिलेगी आपको. So this was an old talk. India and China seem to have a higher rate of osteoarthritis, definitely compared to the West, no doubt about it. It's what I call endemic, यानी है यहाँ पर. It's like polio was endemic. Osteoarthritis is endemic in this country. Everybody has it, right? But it's a preventable disease. It's just go back to what I was saying earlier. It's totally, not completely, I'm not saying 100%, but definitely a certain significant percentage of patients will not come to a doctor if they look after themselves. So 80% of, so we used to be told when we were students early on that if you are 60, you have a 60% chance of osteoarthritis. If you're 70, you have a 70%. If you're 80, you're 80%. Now, the grading of osteoarthritis might differ. So you might have less, some might have more. But that's how it is. And if you've got severe osteoarthritis on one side, within 5 years, even the other side will reach the same. So people who get knee replacement on one side almost certainly will end up getting the other side done sooner or later. We are living longer, no doubt. Medicine is advanced. We can keep you going, right? But that is just going. The heart is going. Brain is dead. Sedentary lifestyle. Yani, at any cost, save my life, but I will not walk, right? So we are able to live longer. We have stents. We have all sorts of microsurgeries going on to keep us going, keep our heart ticking, right? So, but this is the main killer. Really, obesity. India is probably not far from the West in terms of obesity. कौन कहता है यहाँ पे खाना नहीं है? लेकिन it's completely maldistributed, right? So we have obesity is a major disease. It's total lack of self-respect, I feel, if you are overweight and you're just neglecting yourself. That is not right. Okay, that is just selfishness. Anything over, I won't go into BMI and all that, but basically, you know you're obese, overweight. Metabolic syndrome is, everybody who comes to orthopedics also, I ask them, sugar hai? Haan hai. BP hai? Haan hai. Thyroid hai? Haan hai. Cholesterol hai? Haan hai. Everything is out of control. I was talking about muscle weakness, sarcopenia. Everybody talks about bones. Nobody talks about sarcopenia. People can't get off a floor at the age of 30, 40. They have to use their hands and all that, and somehow they manage to stand up. You should be able to stand up with your legs crossed without touching the floor. How many can do that? Hands up. Not bad. Very impressed. Fantastic. So other risk factors bhi hota hai. You can get osteoarthritis. It's called secondary osteoarthritis. So if you have ACL tears, neglected ACL tears, trauma, fractures that involve the knee joint and all that, definitely you'll get osteoarthritis. That's not your fault. Certain sporting activities, like if you're, not every, but certain contact sports, football, for example. Footballers who play for 25, 30 years, they have very high incidence of osteoarthritis. But if you play caroms or if you play table tennis or something like that, you're unlikely to get osteoarthritis. But you might get osteoarthritis because of weakness, right? So the treatment, how we approach the problem is to reduce. Everybody comes to you in pain, so you have to reduce the pain. So you start reducing the pain by first reducing their anxiety and give them reassurance that this is not something that will kill them. It is something that you need to start thinking about. कि आज से मैं अपने lifestyle बदलूंगा. आज से मैं I will start looking after my body. So this is what my main role is. It is very, I came back to India about 10, 12 years ago now. So the practice as a consultant over there was very different, or is very different to practice as a surgeon over here. Because here people come to you as if you're a general practitioner. They come to you because they've heard about you. They come to you with all sorts of issues, not necessarily orthopedic. Right? So my clinic is full of all sorts of people, not necessarily orthopedic patients. Right? So यहाँ पर I've become like a policeman. I kind of direct patients to people I think are good in managing their problem. So I get all sorts of issues. So if they have orthopedic issues, I spend a lot more time with them, trying to explain. Now, the people who I spend more time with are people who have anxiety issues about their condition, about their body conditions, about their pains. And many of them may not have any physical problem. It's mostly mental issues. Mental in the sense they are too sensitive about what it is, and they overthink about what their problem is, and it gets worse. The more you think about it, it gets worse. So even if you have knee pain, if you think, most of the people who have knee pain actually don't have any changes on X-ray. X-ray में कुछ दिखता ही नहीं. So I can spot the X-ray about, as I enter the room, and I'll say, everything will be okay, don't worry. But then they don't leave my room for 15 minutes because they've got hundreds of questions. So we go back, it's educating the young people of our country on good nutrition, regular physical exercise, healthy games, therefore an utmost importance. So basically physical exercise and education studies should be given equal importance in schools, I feel. When we were in public school, every day, 1 hour games, whatever the weather, you're out there. It was like you had to play games. Otherwise, you'll be, you'll get a bad report and your parents will be phoned. Right? And those days, corporal punishment was routine. You can't escape games. So osteoarthritis, basically, this is what we had in our hospital in England. Ladder of treatment. So you start from the bottom, self-management. So this is what I was talking about. Self-management, nothing out there which you don't know. Healthy eating, and many people, kya khana hum log? Indian food, and this is what I tell my patients, is very popular abroad. Why? Because it is tasty. So my standard statement is, ज़बान के लिए मत खाइए, जिस्म के लिए खाइए. Right? So the most cooks who are good basically cook really, really tasty food, not necessarily healthy food. Right? So healthy eating, lifestyle, make lifestyle changes to normal. This is treatment of osteoarthritis. This is where we start. Regular exercise, occasional painkillers, and supplements. Some supplements. But supplements are, I think, the biggest scam of the 20th century. Right? Half the world is on supplements. As if supplements are not there in your food. Right? So all these things are just treatment here more than actually there. So you write something because the patient wants, when the minute they have these tablets given by a good doctor, they are better. But it's not working. But that's fine, as long as you feel better, right? That's okay. Steroid injections, supplement, various. So this medical therapy comes in now. So you have injections and physiotherapy, right? And ultimately the operation. So you have got keyhole surgeries to realignment. So when you have a bowed leg in a young person, we try to realign it. We don't want to put anything in the joint. So we try to realign it. And the lastly is knee replacement. So this is the ultimate. So what you see here is when you walk, you're putting 3 times your body weight on that knee. So if you're 70 kilos, you put 200 kilos on that, 210 kilos. If you're 500 kilos, you're putting 1500 kilos on the knee. Right? And if you obviously can't run at this stage, but if people are built to run, not everybody should run. Right? If God has designed you to run, some people, not everybody, He's not designed everybody to run. Sometimes you're just genetically, you're not designed to run. So don't try and run if you're obese and if you're not, not enjoying that run. Do something else. Because there are a lot of things you can do and still get the aerobic exercise, still cardiovascular exercise. So swimming, you have gym, you have cycling, so many other trekking, all these things. But if you are obese, and the most people think that by jumping they lose weight. In fact, they come to me with a lot of pain after starting to skip, because they haven't skipped for 20 years, and they're now 100 kilos. They start skipping, and what happens? They get bone bruising and cracks in the bone. So you're putting 7 times your body weight when you jump. Physiotherapy is these are people to tell you how to exercise, because if you don't know how to exercise, they'll tell you how to exercise. You're basically strengthening your muscle, improving your range of motion. Muscle is what gives you stability in your knee, right? So this muscle, your calf muscle, is very important. So we stress on quadriceps. So this thigh muscle is so important. So that is the first thing we do to treat osteoarthritis. So muscle strengthening. So you can do muscle strengthening with squats, with lunges, with cycling, with so many other activities, not just jumping. So that doesn't work. So these are typical questions that general people ask me, how much to exercise, what do we do? So you should aim to do about 30 minutes daily if possible. It's not that difficult. It's 30 minutes out of 24 hours. I mean, if you're healthy, then you'll work better as well. You'll study better as well, right? So whatever you do in life, if you're physically fit, you're able to do that job much better. I guarantee you that. Avoid jumping and skipping, as I said. If you have osteoarthritis, don't do that, right? But there are exceptions. And there are people who are able to run a marathon with osteoarthritis because they are lean. They are like very lightweight. Let the bhajan finish. So, low impact activities. So, once or twice a week, you should do an exercise that makes you go out of breath. यानी इतना थक जाना है कि सांस लेने को मुश्किल हो जाना. That is what is called exercise. Exercise is not just stretches, So basically, you need to go out of breath, 2 baar at least in a week. So these are things that you can do. Cycling in Hyderabad mein bahar to nahi kar sakte. Obviously, you'll be killed by an auto coming on the wrong side, right? So you have to do AC room mein karna hai, ya kahin gym mein jaake karna hai, ya ghar mein karna hai. Kuch nahi kar sakte. You can't. I bought an expensive bike to cycle during COVID time. It was so nice. Right? I thought, this is my life. I'm enjoying we used to do 25, 30, 40, 50 kilometers on a cycle with a group of friends. Then COVID finished, then the normal life started. Now I can't even think of taking my bike on the road. सुबह 4 बजे निकलो या 5 बजे निकलो या 6 बजे निकलो, it's traffic, धूल, मट्टी हर जगह. You can't. I mean, it's terrible. So that is, Hyderabad is still the best, by the way, in the whole country. So don't forget weights. Weights are important to get your muscles strong, to keep your joints stable. Shoulders, very, very important to do weights. So I said you don't have to go to a gym. You can do with your own body weight. Planks karo, downward dogs karo, side planks karo, push-ups, pull-ups, all that you can do. So many centers out now open, calisthenics कहते हैं ना उसको. So you can join those things. You can join a lot of youngsters starting all these exercise centers. It's not necessarily just lifting weights. There are a lot of other things you can do to keep yourself fit. If you do suffer from osteoarthritis, which is severe, people are too proud not to take a stick. I don't know why. Right? You can look quite elegant with a nice hat and nice stick, and you use lean. You can use a stick. It offloads the joint. And when you have pain here, you take a stick on your right hand, not the left hand. Not many people know that, right? Not many physiotherapists know that. So always use the opposite, because we walk with right hand, left leg forward. So you take the cane and support, like less weight here and more weight in your hand. So you share the weight. So that offloads the knee joint. You can walk much faster with a cane. And make sure it's the right height. So don't hold it here or here. So it's the right height. It should be just at the hip level. Somebody was asking me about braces just before we started this, right? This will cost you 60,000 rupees. So this is a corrective brace. यानी आपका पैर ऐसा है तो वो ऐसा कर देगा. Lekin you'll have bruisings, you'll have all sorts of issues with the skin by the end of the day. These are not long-term solutions. These are fine for a short term, right? And for relatively mild issues. But in severe osteoarthritis, these things don't work. But you'll see people wearing this all the time. If you wear this, you wear it while you're walking, not when you are at home. If these are too tight, you'll start getting swelling in the legs because it's blocking the blood supply, right? So be judicious in the way we use it. ज़्यादा टाइट नहीं रहना वो. अगर आपको अच्छा लग रहा है वो पहनने से तो पहनो, ऐसा कोई बुरी बात नहीं है वो, लेकिन वो अंदर से कुछ ठीक नहीं करेगा. ऑलिव ऑयल लगाने से ऊपर चमड़े को लगाने से अंदर का जोड़ में ऑयल नहीं जाएगा, ठीक है. ये सब ये जो ट्रेडिशनल ट्रीटमेंट्स है, इस ट्रीटमेंट फॉर योर ब्रेन, नॉट फॉर द नी, राइट. सो यू डूइंग समथिंग टू इट, यू फील बेटर. तो ये चीज़ें हैं, दे हैव अ रोल, बट लिमिटेड रोल. लेकिन companies have become multi-billion-dollar companies with these. Analgesics, some people have it every day. क्या करता है? And does anybody know क्या होता है painkillers खाने से ज़्यादा? Kidneys. So ulcers, you can get ulcers. You can get. Generally, people at that age also have diabetes. So if you don't control your diabetes, you have inherent kidney problem anyway. And then you take these painkillers, it finishes. You get into kidney failure. So paracetamol is probably the safest, but it's not that effective. But it is enough to get you through the day. Tramadol is also safe, codeine is also safe, but they cause other issues like constipation and things like that, a little bit of drowsiness. So and there are people in England who use it every day, 4 times a day, because the doctor has prescribed it. And these are the killers, right? It's okay to take them once in a while. When you're maybe going on a long walk or come back from a long walk, you feel good. ठीक है, ले सकते. These are non-steroidal anti-inflammatories. यानी ये Brufen है, Combiflam है, Dynapar है, ऐसे जो aceclofenac है, Xerodol, ये जो सुनते हैं ना, ये सब these are NSAIDs. So they are very, very effective in osteoarthritis, but not for long term. Then cartilage nutrients, जो बता रहा था मैं, glucosamine, collagens, these are all okay. They do help a little bit, but mostly in early osteoarthritis. And then injections, कह रहा था मैं earlier on, steroids है. These are the most commonly used injections. So they can be used in stage 2, stage 3. 4 में उतने इफेक्टिव नहीं रहते. ठीक है, हम लोग कभी देते हैं क्योंकि शादी है घर में या कहीं जाना है या ट्रैवल करना है, तो it helps you for maybe 2-3 months, but it's not a long-term solution. HA is hyaluronic acid. यानी these are like putting grease into the joint. Right? But they're not, again, they might help in early stages for a year. 1 साल शायद 2 साल काम करेंगे, लेकिन नहीं. Beware of PRP, pain clinic. I said con. These are con jobs, right? ये लोग क्या कर रहे हैं? आपको बड़े-बड़े एडवर्टाइजमेंट्स कर रहे हैं पेपर में कि ये इंजेक्शन ले लो, आपको नी रिप्लेसमेंट की जरूरत नहीं पड़ेगी, right? And these people, I won't take any names, but they have become politicians. They are driving Maybachs, Mercedes, करोड़ों की गाड़ियाँ, क्योंकि आपसे 2 इंजेक्शंस देंगे, बड़ी फैंसी मशीन्स रखेंगे, आपको बताएंगे आपकी कार्टिलेज यहाँ नहीं है, तो हम इंजेक्शन देंगे उसमें. So they give you mostly PRP, and PRP is made from your blood. Platelet rich plasma, थोड़ा blood लेके उसको spin करके उसकी खूबियाँ निकाल के आपकी घुटने के अंदर डालते हैं. ठीक है, लेकिन स्टेज 4 में ये काम नहीं करते. तो आपसे 1.5-2 लाख ले लेंगे, फिर आप फिर से जाएंगे, फिर वो कहेंगे कि एक और लो, फिर एक और 1.5 लाख लेंगे आपसे, तो 4-5 लाख के बाद कहेंगे कि नहीं आपका बहुत एडवांस है, अब आप नी रिप्लेसमेंट करा लो, राइट? सो दीज थिंग्स आर हैपनिंग वेरी वेरी रेगुलरली एंड people descend down to them because they don't want surgery. Why? Because they feel surgery is the last thing you should do, और सबसे खराब चीज़ है, यानी कभी कराना ही नहीं है. So लोगों के दिमाग में ये बैठ गया, क्योंकि यहाँ पर क्या है, रिप्लेसमेंट्स आर बीइंग डन बाय काउबॉयज. कहीं भी 2 पैसे यहाँ पर कम होता है, वहाँ पर लोग चले जाते हैं, खराब होगा जॉब, right? So good operation has been given a bad name because there is no control on who does knee replacements in India. कोई भी कर सकता, MBBS भी कर सकता. You don't have to have MS. कोई पूछेगा भी नहीं आपसे. But the people who go to jail are the ones who are trying to do their best. They are the honest ones. खैर कीहोल सर्जरी काम नहीं करता. You'll see this. This is bone. This is cartilage. So if you do keyhole surgery for osteoarthritis, it will work for 2 months. उसके बाद नहीं करेगा. So it's banned in England, it's banned in Canada, it's banned in US. US में शायद नहीं, because US is like India. You know, you can do anything you want, right? There are no regulations for doctors. तो वहाँ पर you can probably get arthroscopy for knee osteoarthritis. वो अंदर डाल के 15-20 मिनट साफ करके छोड़ देंगे आपको. तो अच्छा लगता है 2-4 महीने. उसके बाद से बैक टू नॉर्मल. सो ये हड्डी है, ये हड्डी. दिस इज बोन. दिस इज बोन ऑन बोन, क्योंकि कार्टिलेज यहाँ पर नहीं है, घस गया, ये कवरिंग घस गई, राइट? दिस इज स्टेज फॉर सर्जरी. So basically this trial in Canada said that you can't do arthroscopy for severe osteoarthritis. So I told you about correction. So what we do in young people is we correct the alignment. So alignment, अगर यहाँ पर देखें आप, this is a 40-year-old with osteoarthritis affecting one compartment. तो उसको ये plate बाहर लगाने से you basically correct the alignment of the leg. And here you can see very clearly that you've opened up the space, right? So that you're giving it a chance to regrow cartilage. यहाँ पर. So this is called an osteotomy, and we prefer to do this in young people who have osteoarthritis and they're suffering and they're not enjoying the life. तो young लोगों में ये चलेगा. In the replacement जब आओगे आप तो yes, but this is the most important question people ask me. क्या करना, कब कराना surgery? कराना या नहीं? नहीं कराए तो चलेगा क्या? So all these are very valid questions. So knee replacement is not like heart surgery, you know, it's not life-saving surgery, but it is lifestyle surgery. Yani you are changing your lifestyle. So a certain surgeon in the UK looked at the lifespan of people who had joint replacements done compared to a similar cohort of patients who didn't have joint replacements or waiting to have joint replacements done or are suffering with osteoarthritis. What he found was people who had joint replacement done tended to live longer than people who didn't have it done or got scared of having it done. And I see this regularly because I see people come to me in a wheelchair, they have been advised knee replacement 10 years ago. लेकिन डर कर नहीं कराए. तो क्या हुआ? वो लेटे रहे, कमज़ोर हो गए, अब तो बिस्तर से भी उठने नहीं आता उनको. So when they come back to me, I said, आपको नहीं कर सकते आपको. Because if I touch you, you won't survive the operation. You're so like physically unfit to get it done. So you should get it done when you feel that your life, it is affecting everything that you do in life. यानी चेयर से उठना, सुबह उठना, हर चीज़ के लिए टाइम लग रहा है. You're thinking, अरे वहाँ नहीं जाऊँगा मैं क्योंकि वहाँ पर सीढ़ी चढ़ना पड़ेगा. नहीं, मैं ट्रैवल नहीं कर सकता हूँ क्योंकि मुझे एयरपोर्ट्स में चलना पड़ेगा. So all when it's affecting your life, you're slowing down, you're not enjoying life, and you have X-ray changes of grade 4 osteoarthritis, get it done for God's sake. Don't delay it too much. Because if you delay and your muscles get weak, then recovery takes longer. So there are a lot of misconceptions that are told. Because यहाँ पर क्या होता है, दूसरे डॉक्टर्स और घर, फर्स्ट जब इंग्लैंड से आया था तो even doctors didn't know much about it. तो ये लोग कहते थे कि नहीं, तुम नहीं कराना, you should get it done when you are 60, 70 years old, right? And so they used to discourage patients from getting it. And now आपके घर के बाजू या आपके friends या आपके relatives, they are more of a doctor than I am because they advise my patients what they should get done or not get done. So this is the problem I face now every day. सर आप मुझे सिर्फ दवाइयाँ देना, ऑपरेशन का नाम ही नहीं लेना. और आप गलत जगह आए. आप, मैं एक जगह एक एड्रेस बताता हूँ, वहाँ झाड़ के नीचे एक पुड़िया देने वाला बैठता, वहाँ जाइए आप, वो आपको अच्छे पाउडर्स देगा, अच्छे टैबलेट्स देगा. मेरे पास तो नहीं है आपका ट्रीटमेंट. राइट, मतलब लेट स्टेज पर जब होता है ना, तो दिस इज व्हाट आई टेल देम. व्हाट कैन आई डू? आई गेट सो फ्रस्ट्रेटेड बाय द एंड ऑफ द डे. दिस इज द 10th पेशेंट टेलिंग मी नॉट, आई शुड नॉट ऑपरेट एंड गिव समथिंग एल्स. मैजिक नहीं होता ऐसा. So we do two types, right? When India में 40% of my knee replacements are partial. 40%. Why? Because only one compartment is gone. Why replace the whole knee? It's like, for a puncture, you're changing the whole tire. Not necessary. So this works amazingly well because it's अभी recently किसी में किया था मैं यहीं पर से. छोटा सा incision, you just put an implant on one side. Your knee feels more natural because most of your knee is not been touched. Even the ligaments have not been touched. So you recover far quicker, and you've got more of people are jogging with this. Even there are coaches in cricket who've had it done and they are back on the field. So this is a far effective operation compared to a full replacement. Full replacement हमको ligament भी हटाना पड़ता है. It's still a good operation, but generally preferred in people who are not that active or don't want to get back to sports, right? So I would still prefer this to this if you're suitable for it. Okay, this has a slightly higher revision rate compared to this, but it has a far better function compared to a total knee replacement. So partial replacement is now slowly being accepted as an alternative to TKR in suitable cases. Nobody heard about it when I started doing it 10 years ago. So I've been doing it for 20 years now. The results are amazing, by and large. But you do see the odd complication, which you don't see in total knee replacement. But the total knee replacement is a far bigger operation. And so there are complications of the operation in people who are unfit. यानी आपको फिटनेस नहीं है, आप सर्जरी कर दिए, तो कॉम्प्लिकेशंस होने के चांसेस ज़्यादा है. तो इसमें हम लोग बाद में बात कर सकते हैं, if you have questions about complications. Many people come to me saying, कौन सा डालोगे आप? So they're now telling me what I should put in their knee. Johnson & Johnson डालो या Oxenium का डालो या Gold का डालो, कौन सा? So they want me to lay out like a jeweler all different kinds of knee replacements so that they can pick जो भी अच्छा दिखा वो डालो अंदर. वो ये नहीं पूछेंगे कि ये 50,000 ज़्यादा है या 1 लाख ज़्यादा. So these are all con games that doctors play and companies play on you. कि ये डाल लो आप, ये आपको कोटेड नहीं है और ये ज़्यादा चलेगा. ये मार्केट में आकर ही 5 साल हुआ, तो कैसा, हाउ कैन दे प्रिडिक्ट, राइट? सो दीज आर थिंग्स दैट you should be very careful about. You should say, put the knee that has the longest track record, right? So it is not just the implant. Implant plays a very, very minor role in my books. Actually, it is how you do it. How you implant it. What is the alignment of the knee after you implant it? Have you balanced the knee? अगर आप इंडिया में तो you see varieties of everything, like the professionalism in any profession is, variable depending upon who you get. Whether you lay tiles or whether you put sockets on the wall or something, you'll see आड़ा टेढ़ा हर जगह, right? So imagine swing, right? एक रस्सी थोड़ी सी छोटी रही और लंबी रही, ठीक है, इस काम कर रहा है वो, लेकिन मज़ा नहीं आ रहा यार, ऐसे बैठे हुए हम, राइट? गाड़ी का पहिया थोड़ा सा अलाइनमेंट टेढ़ा है, नई गाड़ी है, राइट? पहले वो फिएट एम्बेसडर्स आते थे ना रेगुलरली, और मेल अलाइंड व्हील्स, तो अगर थोड़ा भी अगर पहिया टेढ़ा है और गाड़ी अच्छी है, 2 करोड़ की गाड़ी है, लेकिन मज़ा नहीं आ रहा है क्योंकि गाड़ी ऐसा छोड़ते इधर चली जा रही. So if you implant a bad knee, you'll get a bad result. And that is why you're hearing, yeah, operation अच्छा नहीं है, क्योंकि we are seeing all sorts of cowboys doing all sorts of types of replacements, putting in the most expensive knee available. अगर आप छोटे लड़के को जो अभी सीखा गाड़ी चलाना, उसको फरारी दिए, वो क्रैश करे, गाड़ी का फॉल्ट थोड़ी है. मतलब you've got to be experienced and know what you're doing. So it's very important that whoever does it for you, You should not hesitate to look into his background and see where has he learned, where has he done his training, who has taught him, how many has he done. Now, people might be doing hundreds, but they might be doing exactly the same thing for each of the patient wrongly. Right? So people have become very famous by doing knee replacements. But what are the results? Knee replacement has the highest dissatisfaction rate around the globe. Because it is, first of all, they do it inappropriately. यानी आपको ज़रूरत नहीं है तो भी कर देते. So expectations after knee replacements are very high. यानी मुझे, suppose you have pain after walking 10 kilometers, right? वो लोगों में आप knee replacement करें तो they will curse you for the rest of their lives. You should do it when it's really necessary, like when you really need it. So beware of that. Beware of what advice you get in various clinics. And do your homework and do visit a few people, and then you try and understand what your situation is. It is not a life-saving surgery, it's a lifestyle surgery. And now, this thing has come in, hearing about robotic surgery and all that. Of course, in the right hands, because it is not the robot who's doing the surgery. You are still doing the surgery. Because you are the one who is putting in the data into the robot. And it'll follow your advice. If you put in the wrong data, it'll do a wrong cut. But the beauty about the robot is if you know what you're doing, if you know your biomechanics, you put in the right data, the knee is perfectly balanced. They recover far quickly. The patients, I find that they are getting up and walking very quickly. And they're able to go up and down, for example, up and down stairs and walk fast and all that. Things become easier and normal very quickly after that because the stability is there. So knee has to be balanced in flexion and extension. यानी bend करे तो भी उतना ही balance रहना और extend करे तो loose नहीं रहना घुटना. अगर replacing के बाद घुटना align नहीं है बराबर या balance नहीं है उसमें तो फिर it won't work properly. So this gives me that extra. It's a better tool I feel than doing conventionally with standard tools. So yeah, basically I've got a tool which does a far more precise job than my standard conventional tool. So that is why I'm a bit more upbeat about this modern technology. Thank you very much. That was exhaustive. I'm sorry I went on for too long. I didn't realize how long it would take. So please fire away. Questions?
Sir, please say how one can reverse whatever. Can you please advise how can people in home reverse before it's too late? I mean, what are the lifestyle habits and what is the food specifically? Can you please?
So food, basically, as we are not nutritionists, but I can tell you that avoid eating overcooked. More natural the food is, the better, right? And avoid eating anything that is too much of anything that is white. Right? Your rice, your sugar, your wheat, maida, all these things are not good for you. So, India में क्या है, rice के बहुत शौक है. तो ठीक है खाओ, लेकिन अगर आप exercise करें, आपको diabetes नहीं है तो चलेगा. लेकिन this is not the right kind of food in excess quantities. Don't eat too much of anything. Have a balanced diet. यानी all colors should be there on your plate. From red, green, yellow, purple, हर चीज़ रहना. Fruits are not as good as you think they are, because most of them are sweet, and we are now genetically modifying them to taste sweeter, right? So they're not necessarily that good. So eat the right kind of food, local fruit. Papaya, for example, is good. Berries, different types of berries, nuts, everything in moderation. If you're obese, overweight, try and get into intermittent fasting. You should fast for at least 16 hours. You can have water, green tea, black coffee, black tea, all these things. Avoid milk. Milk is not necessarily good for you. Many people are allergic to milk. They don't realize they're flatulent, they have gases, they get into indigestion after taking milk, but they want milk, right? So that is not necessarily good for you. You have alternative milk, soya milk, almond milk, all that. पूछिए. No, he raised his hand first. blue shirt, dark shirt.
Sir, this is an observation. By experimenting on myself, I love bitter gourd very much. After eating bitter gourd, the second
After
day.
eating what, sorry?
Bitter gourd.
Huh?
Bitter gourd.
Correct, yeah.
The second day, my knee joint, as if the nail is piercing it very powerful when I walk the stairs. The third day also it persists. Fourth day I am normal walking the stairs. So this bitter gourd, whether it's a green variety or the white variety, I think it is it because of the bitter gourd or some chemicals added to it that is causing this pain in the knees?
So you feel after eating
After eating the second day,
second, third day, you feel good.
no, I feel the pain.
You feel the pain. Okay, yeah.
Nail piercing my knees.
Yeah.
Nail piercing my knees.
Avoid it then.
While climbing the stairs.
Yeah. See, climbing the stairs, the pain when you climb up and down stairs, go up and down stairs, is a different reason. It's usually due to the kneecap, right? So, again, the kneecap is controlled by the quadriceps muscle. So that is the most common type of pain I see.
It's only the bitter gourd I observed. If I don't
Maybe. Some people have certain reactions to foods. Who else?
You have mentioned weight loss that 1 to 3 inches. That is because of age or vitamin deficiency.
Nah. So what happens if your bones are not strong? You get into osteoporosis. Osteoporosis is weak bones. Bones get stronger with using the bones, like exercise, vitamin D, which is only in the sunlight, unless you take supplements, okay, and calcium. A good, well-rounded diet. Agar wo raha, if you have all that in your daily life from childhood, your height will not go down as much. Maybe it will go down half an inch over your entire life or an inch. But you see people losing 3 to 4 inches in height because of their lifestyle, osteoporosis. So that is important.
I have one instance that one of my uncle got, he needs to have knee surgery, but he's having diabetes. Because of that, when we are taking to the hospital, his pulse getting down. He's not able to handle him properly. So could you please suggest us that how can he?
So he needs knee replacement, but he has diabetes, which is not controlled.
Yeah, little bit. It's a little bit complicated.
Yeah, basically, you see, what we do before surgery is to make sure that they are fit.
Yeah, that is good, but no, he's getting tense.
That is a problem, right? So
And because of the diabetes, he's getting afraid of.
no, yeah, that is the problem. Everybody has diabetes in India. Diabetes is the capital of the world.
Like, will it affect the body, enter the
No,
body?
control it and then get it done. Control it and then get physically fit for surgery. Hanji.
Thank you.
Yes.
Yes.
I am 69.
Sure.
My flat is on second floor.
Right.
Normally I use stairs. I avoid lift. But since last 1 month I am feeling pain in my left knee. Should I continue to use stairs or I should take a lift?
No, are you feeling the stairs are aggravating it?
I don't know.
No, if you feel that you can't climb the steps because of your knee,
No. I
then
can
you
climb.
avoid for some time,
I
right?
can climb and that is no
Yeah,
problem.
no, that's go for it. I never stop people from climbing stairs.
Okay.
Right? This is a must. You should not. I go up and down 5 floors 10 times a day. So that is not. It is not the cause of your pain,
Okay.
right? But if it's aggravating the situation, you step back a little bit, maybe use the lift for a few days, and then go back to it, and work on fitness. Again.
Right, sir.
It is able to recognize by it is incremental pain because even if you do exercise, you will get pain.
Correct.
So pain is okay, but if it is, you have to observe if it is keeping on increasing, that means something is wrong. Go and get it tested.
100%.
But if you climb and you get pain, that is okay. So
That-
you have to observe, climb again, and try to see what is happening to the pain.
Correct. That's what I tell my patients. If they suddenly start climbing stairs, they'll get pain. If they suddenly start exercising, they'll get pain. It doesn't mean that they should stop. Excuse me. Don't do the same exercise every day. Do different types of exercises. So use all bits of your body. If you do the same thing, then you will get pain.
Sir, actually, as you see my leg, I have some swelling here, and as what you shown us on the slides, some grade 2, what I feel in my knee. When I sit and get up, I get some sort of slightly some sound, So what I came to know from orthopedic surgeon recently, some 1 month before, that the gap has reduced in my knee. So he has advised me some medication, some Deflon, some other tablets, and some painkillers. If it is rare, if it gives severe pain. So what happens if I sit some half an hour something to get up? Also, it's getting I'm feeling pain. So
Yeah.
and this is due to my weight. As you see, I am 105 kg.
Yeah.
So I'm controlling now day by
Yeah.
day. So it's slightly it is coming under control. So what's your suggestions of why I'm getting like this? He said slightly gap has reduced in your
I
knee.
would encourage people to ask questions in general rather than personal, because it is something that I cannot answer immediately, because obviously, you have pain, you need to be evaluated, you've got swollen legs, what is causing the swollen legs? We need to get to the root of that. I can see afterwards if you want.
Walking on road or mitti or grass.
Good question. Walk bare feet if possible. Make sure you're not in danger of having nails stuck into you. Barefoot walking is good for you because it encourages quick reaction times. Okay, and we are generally using. See, if you look at your soles, they're as soft as a baby's, even in adults, because the doctors are telling them to use softer and softer insoles. That is not necessarily correct. You need to be rough and tough, right? So walking on the road might be dangerous, but in a secure area, in a clean area, it's fine. Walk on sand, walk on grass, walk on fine sand, use textured rollers. All that is good for your foot as well as the body. Sorry? Yeah, barefoot is good. But start in easy areas first and gradually build up.
Treadmill can work, sir.
Treadmill is fine.
So, do calcium supplements actually work?
No. So overuse of calcium. Everybody gives calcium here. You end up, you see, they are, unfortunately, part of the problem with the calcium industry is that they are causing greenhouse gases by taking away the coral of the sea. Sea is dying because of your calcium intake.
Best would be drumsticks.
Yeah, green leafy, anything that is green has calcium. Nuts, soya, your, dairy products, cheeses, all that.
One small question regarding that braces what you showed, sir. One is 60,000, the other one it could be 6,000 whatever.
400 rupees. Yeah.
Yeah, but how effective is
So that 60,000 rupee has a purpose. The other one is just for your mind, right? The one that is causing sick is correcting the alignment, so it's offloading the joint which is painful. So it's a more,
So starting of this is a starting period of knee pain, but we have diabetic. Can we use the tablet or can you prevent that with any medicines or
see,
walking, exercise?
osteoarthritis is not treated by medicines.
But with
Please remember that.
Okay?
Exercise, yeah,
Dieting,
it's fine, yeah.
it is okay.
That's what I was saying throughout my lecture.
Okay, thank you so much.
Yeah, anybody else? Too many. Yeah.
Hi, Doctor. First of all, I would like to thank you for the eye-opening session you made. It was really good, actually. I would like to thank on the for everyone.
जरूर इनको कहने दो.
मेरा अर्थराइटिस था,
हाँ.
पाँव धनुष की तरह हो गया था. हम बहुत परेशान थे, 40 से 45 के बीच में एज में, चल भी नहीं पाते थे यहाँ से वहाँ तक. और उसके बाद हम परेशान हो गए. लड़का लोग 2 लड़का था, खाना भी नहीं बना सकती थी, लेकिन फिर भी अपना हिम्मत नहीं हारी,
बिल्कुल
बनाते रहे. उसके बाद यहाँ पूना में डॉक्टर के पास में गए तो वो बोले कि जो तुरंत 5 लाख जमा कीजिए, आपका ट्रांसफर अति करेंगे, घुटना के ऑपरेशन करेंगे. फिर मेरे पति RMD सेल में सर्विस करते थे, तो कंपनी के थ्रू भेलोर CMC में गए तो वहाँ के डॉक्टर बताएं जो नी पर ट्रांसप्लांट कोई इसका इलाज नहीं है, करा देंगे. अभी आपका उम्र 50 साल है, 10 साल उसका एज है, उसके बाद फिर आपका वही प्रॉब्लम होगा. आप एक्सरसाइज कीजिए, आप प्लस एक ठो टेबलेट दिए ग्लूकोजामिन, वो 2 साल खाएं और उसके बाद फिजियोथेरेपी वाली से कराएं, एक्सरसाइज कंटिन्यू करते रहे. बिल्कुल ठीक. अभी बिल्कुल
तो वही तो कह रहा था मैं जब से. Young lady. हाँ.
She has grade 4 situation and she definitely need a surgery. So how can we be sure that whether someone needs
So that's why I
surgery or
said
not?
it's not a life-saving surgery. It is what you can do, you can't do. If it's affecting your daily life to such an extent that you're not enjoying your life and you have grade 4, it's a good time to consider. But it's not necessary that it's not an emergency.
Sir, I have two questions. One is related to accessibility and affordability of surgery in India. And another question is related to technology and innovation in India. I lived in the US for 5 years and I saw state-of-the-art medical technology there. But in India, I see like the technology is like almost 30 years backward in many ways. Like there is no robotic exoskeletons and like there are many, even in the orthopedics, like brain-computer interfaces, like these are new cutting-edge technologies which are only available in US and some parts of Europe. When do you see those kind of technologies coming into India? And what do you see the future of medical technology in orthopedics and biomechanics in India? And my another question is related to accessibility and affordability. Like in the US and Europe, there is state-funded healthcare and you have insurance. And even if the surgery costs 1 crore, ultimate your copay will be like $1,500. Whereas in India, 90% of the population does not have insurance. And these implants are very expensive, like 2 lakhs, 3 lakhs, like very expensive and not affordable to majority of the, like only 10% of the India can afford this kind of surgeries. So, and most of the population is uninsured. So, what are the ways where people who really need it can access and afford these kind of technologies, which like the knee replacement surgeries? Are there any avenues in India where they can get surgeries done? Like there is something called like, there are some hospitals like Satya Sai Hospital where they do free surgeries. Like, are there any more facilities in India like that where people can access these? So these are
Okay,
the
I think I've forgotten what you asked first now. Anyway, I think the technology is there in India. What you talked about is like experimental, a lot of exoskeleton and computer brain interface. It's all there. In fact, there are more MRIs in Hyderabad than most of Europe combined. You know, every gully has an MRI scan. Right? So we have access to the latest technology, no doubt. The robot that you saw over there is made in India. Now they've got FDA approval. They're gunning for the FDA approval and moving into Europe. We have technology, we have the brain, right? Unfortunately, what your second part of your question is, do we have avenues where people can get it done? No. Most of them can't afford it, right? And all these government schemes are fraud schemes. Basically, no hospital will accept it. If you give 2 paisa for something that costs 1 rupee, which hospital can do the operation well for you? I mean, they'll use all cheap implants, non-branded drugs. We can't do a good operation. So basically, I said, look, it's better not to get it done than get it done in Arogyasri or Ayushman also is fraud, right? And basically, they are just methods to get your vote, but they're not effective. They just don't pay for a good operation. They are just just a scheme to say that I've done this or we have done this and this party has done that. So be careful. Insurance is lacking, yes. Insurance companies are also fraud. They'll promise you 20 lakhs, but they don't pay the hospital anything, right? So beware of which company you're going for. Read into that, talk to people and talk to hospitals, because they will say that, okay, you're covered for 20 lakhs, but they will pay 2 paisa to the hospital. And so most hospitals, if you are covered by a certain company, they won't use disposables. They won't use branded drugs. They won't use standard implants. So you won't know about it because the hospital is not able to give you a good operation for that amount of money. I know there are a lot of issues with hospitals, private hospitals, doctors, overcharging, this and that. But by and large, India is still the cheapest place for the best operation in the world. By and large, by far, including Bangladesh. So we are cheaper than Bangladesh, we're cheaper than Pakistan, we're cheaper than... why do people come to us? From, medical tourism, huge in India. 2 lakhs rupees the knee cost, knee implant. In America, it costs $40,000. Almost 40 lakhs. You can't compare it. Same surgeon, same implant, same kind of hospital, same kind of service. Same, there's no in fact, I would say technically Indians are far better in many operations.
Sir, give tips to improve oil in the knee joint, sir.
रात भर चलेगा ये बाहर से डाल लो. No, but our cartilage is a sponge, right? When it compresses, when you load the joint, it leaks out oil. When you take the load off, it takes oil back in. So it's like a sponge, and it has to be used. Human beings are not like machines. The more you use it, the more they wear out, right? The more you use it, the stronger they get. That is a natural machine. So a joint, if you need more oil, you use it more. That's the only way. क्या है वो? Well, that's all it is. It's all Baba Ramdev type,
One simple query I have.
fraud people who giving you, they're making much more money than by fooling you, basically. Maybe you don't have arthritis,
One query I have, it's not regarding surgery or something, but I have seen in my family itself that at the young age, in late 20s or early 30s, when we are doing sit-ups and all, there are knee sounds. Is it any alarming
Don't
situation?
worry. It's a good question. Many people come to me with that. Don't worry about the sounds. People are always clicking their fingers and all that. That's sound coming from joint. Joints make sounds.
Okay.
No joint is silent. And as you get older, the more noisy they get.
Because whenever we are doing sit-ups and all, it's coming. And
That's fine. Don't worry about it.
secondly, small question, I have seen a lot of people are like taking the clicks of presentation and all. Is it possible? Can we get a copy of it by? Thank you.
It's not something you won't find in the internet.
I have a nutrition.
हाँ. हाँ. यानी हाँ पिलो रख के या
पिलो रख के उठे तो कोई बात नहीं, मगर जमीन पे पैर घुटना नहीं लग सकता, तो उसका क्या कारण है?
यानी जब आप नीचे नीलिंग करते हैं,
मतलब एक्सरसाइज करते हैं तो नीचे बैठते ना,
घुटना तो लगना चाहिए ना नीचे, मतलब
अब नीचे बैठ के उठेंगे ना अपन, तो
हाँ.
घुटना तो लगा के ही उठेंगे ना, ऐसे तो
करेक्ट
कैसे उठेंगे?
करेक्ट
तो वो घुटना अगर मेरा जमीन पे लगता है तो मेरा 15 दिन तक दर्द नहीं जाता.
दैट्स फाइन. डू व्हाट यू कैन. जो भी कर सके आप करिए, ठीक है. धीरे धीरे बढ़ाइए आप. तो अगर आपके घुटने तो सीधे ही लग रहे हैं मुझे, तो ज़्यादा आपको प्रॉब्लम नहीं होना चाहिए.
पूरे सीधे नहीं है. एक्सरसाइज करते तो जैसे पैर उठाते ना, तो थोड़ा ऐसा रहता है.
कोई बात नहीं, करते रहिए. डोंट हाँ, अलग अलग टाइप के एक्सरसाइजेस करना, रोज वही नहीं करना, अलग अलग डिफरेंट टाइप्स के एक्सरसाइजेस करना. पूरे बॉडी, सिर्फ घुटनों का नहीं करना, बॉडी का करना, गर्दन से लेके टखने तक.
मतलब 1 घंटा तो होता ही
अब
है.
जरूर. वेरी गुड.
घुटना जमीन में लगने से क्यों दर्द होता है?
शायद आपको आर्थराइटिस होगा अंदर, एक्सरे लेकर देखिए. ठीक है.
Sir, there is one, Mahabira seeds they call. It's a nutrition related that in the night if you soak and morning you drink, it will help in.
Yeah, I mean, there are a lot of, body requires a lot of different types of foods, and there are certain foods that contain antioxidants, and they kill off all the badness in your body, things that are normally shouldn't be there circulating in the body. So antioxidants help in neutralizing those. So a lot of these seeds contain that. And what doctors give you as supplements and as vitamins contain antioxidants. So there are a lot of good supplements out there. I think you should know.
So the natural seeds are good. I mean,
yes, definitely.
In the night, and then
100%. Yeah.
Soaking in the night. In the night you have to soak, and in the morning.
I don't know about soaking, whether it makes, because it's easier to have that seed, I guess, when it's softer. Hanji.
Sir, while walking upstairs, sir, so does it make any difference if you walk sideways like a crab?
Whatever pleases you. See, people find ways of going up and down stairs, so that's fine. But if you're disabled, you can do it. But if you're normally able body, why should you do it? But it doesn't make any, some people find it easier to go this way, sideways. That's fine. If you can't go upstairs normally, then do it that way. Doesn't matter. As long as you're doing it. No, she asked first.
Sir, is lower back pain anywhere related to osteoarthritis later in the future?
Osteoporosis, yes. Osteoarthritis also, yes. It's called spondylosis in your back. So backs need to be looked after very well. In fact, more than the knees. So that's why this is the core, right? So this has to be strong. So if you don't keep this strong, you'll get back pain. So for your back pain, you need to do a lot of core exercises.
Thank you, sir.
Om Shanti.
Om Shanti.
So with your questions, I can understand how much you are very enthusiastic to listen to Dr. Udai. And it was very interesting. He made it very interesting. Yes. And so many questions have been cleared. Yeah. So as in the beginning, doctor was saying that I was there in his clinic. And that was actually so sudden thing happened, but it was good. Because I really love the way he talked to us, and his father is a gem.
Dr. Ved Prakash.
Dr. Ved Prakash, he is one of the senior, I can say one person like that whom I had seen. 92 years old. He's orthopedic surgeon. Lekin 92 years, he's so fit. He's so young. His face is so radiant. Every day he does meditation. And every day he does exercise. And he was, utak betak jo karte hain, squats, he was doing that in 92.
He demonstrates that to the patients who
Yeah.
are half his age, who can't do it.
Right. Exactly. तो ये questions पूछने की बात ही नहीं है. जब उनका देखा मैंने, that is different. And then when I met him, I said, you have to come to our audience. And this is how it happens. Sunday evening talk. Actually, one of our Mataji who comes here regularly, who is in this practice of Brahma Kumaris over 50 years, Durga Mataji. So he got operated with Dr. Udai, and we went to see that Mataji, and that is how we met Dr. Saab. And see how good it all happened, that you all took benefit. And from the YouTube talk also, many more will take the benefit from this session.
Sure. Yeah.
So from bottom of our heart, thank Dr. Saab and for your time, for your readiness that as soon as I asked for this Sunday, he was ready and being busy, and then later we realized that he was busy, occupied already in different thing, and still he accepted to be here and clear these doubts. I request Sister Ritu Shukla, who is the better half of Dr. Udai, please do come. Please come.
Also, I would like to call Bhushan Bhaiji so that we can honor our guests. Bhushan Bhaiji.
Bhushan Bhaiya. Please come, please come. Just they want to see you. So.
She's
this is what. Please come. So,
she manages me.
इधर बीच में. So.
Yeah, sure.
So nice, they have come, and they have another commitment 8:30, and I promised them that we will finish by 8 o'clock. But so many questions, general questions, that's why we cut off that. Sorry for that. And thank you once again, Dr. Udai ji, as well as Ritu ji.
I enjoyed
thank you
it.
very much. And we want to see you more and more, and maybe not only the sessions, but for your empowerment
Sure.
also.
Yeah.
Be here and take the benefit from this place also.
Sure. Thank you so
thank
much.
you. They have been here for Sister Shivani's talk actually.
Yeah.
But now this is different purpose. They have come to serve all of us. So thank you. And on behalf of Brahma Kumaris, Prasad.
Thank you.
जी. So Shivani Didi ka book
Bilkul, we'll enjoy that.
This is the small gift for your clinic or
Yes,
somewhere.
of course.
This is positive tendencies and negative tendencies. Whatever we plant, that seed will grow what it grows. It's a
Sure.
good exercise for your mind. So please do
Definitely.
it. Thank you.
Thank you. Thank you. Enjoyed
once
it.
again.